The coronavirus pandemic has been affecting everybody worldwide, but there are certain groups of people who have been caring for the most sick and the most vulnerable, whilst also having to worry about their own health and their families at home. One of these groups of people are our amazing NHS Carers, and many of you will have seen the brilliant initiative called Clap for Carers, which has seen hundreds of thousands of people standing on their doorsteps, clapping, cheering and banging pots and pans along with their neighbours for our NHS Carers. We wanted to talk to some of our NHS Carers from our own church community to see what their experience is and how we can be praying for them.
Hi, my name's Ruth. I'm a proactive care nurse, which normally means I visit the over 70s in their own homes.
So hello, my name's Libby and I work as a midwife and I'm based at the maternity centre here in Andover.
Hello, my name's Katie. I work for the reopenment team. That's a team here in Hampshire which is a mix of NHS and Hampshire County Council staff working together to arrange hospital discharges and to provide support to people once they have been discharged from hospital to home.
Hi, so I'm Rachel Sidwell. Many of you will know Mark and I and our children Nathan and James. I'm a nurse practitioner in a doctor's surgery, two surgeries, Whitchurch Surgery and St Marybourne.
With the recent changes, we're no longer able to visit people, so we moved on to telephoning them instead. Having done that for a few weeks, my job has changed yet again, and now I visit anybody over the age of 18 in their homes if they need routine care that they would normally have been receiving at their GP surgery, but they are stuck at home because they are self-isolating. There's been a lot of challenges involved with that. I'm using skills I haven't used for many years, and therefore I've needed to do some updating and some training. And it's also meant that I'm travelling much further than I would normally travel and working with many different GP surgeries than I would normally be engaging with. I've enjoyed the challenge. It's nice to feel useful. It's nice to feel that I have something to offer and that I can make a difference and a positive difference in people's lives at this time.
Work for us at the moment is super busy and all of the midwifery team are having to wear protective gear like I've got on now. So this is to protect us as well as our women, and it can be a little bit unnerving for women when they're attending here at the maternity centre for their antenatal and postnatal care. So I've kind of kept it on to show you. It's really odd for us at the moment because women are also having to come in to see us on their own or with their babies. And which is strange because having a baby is a real family affair, but unfortunately dads and siblings are having to wait in cars outside. Work itself is actually taking us longer because we're having to change our aprons and our gloves between patients, but keep our masks on because there is a little bit of a shortage of them. So we keep them on for as long as we can and then obviously change them when necessary.
As you can imagine, it's quite busy at the moment. It's quite challenging for our staff to keep up with new policies, procedures, something that's so unknown and that we've never experienced before. It's really hard to know how to handle it, and you just sort of hope you're doing the right thing each day and keeping everyone safe as possible. The main difference has been obviously if we are supporting people home from hospital who have been tested positive, there's a lot more extra precautions, extra protective clothing to wear and like I said before, new policies, procedures to work by. So we just have to make sure we're up to date with that, but still making sure that all of our service users, all of our vulnerable adults are being well looked after, but also that our staff are safe too. And as you can imagine, we're short on the ground whilst people are self-isolating. So it has been a bit of a challenge.
So my job as a nurse practitioner is primarily it's a very similar role to the GPs really. We work in small teams. We have patients that we know very well. We really like to have a lot of continuity in our work, and that obviously particularly at this time with the COVID pandemic, has proved really useful because we do know our patients very well, and can hopefully support them the best we can. Primary care, general practice has quietened down an awful lot. We are doing everything on the telephone, which obviously does bring some problems and some uncertainties itself. One of the things we are concerned about is people's need to seek medical help for things that aren't related to COVID, that maybe people are delaying, holding off getting in touch with the surgeries. And Jackie said that people are turning up at the hospital in a much sicker way than they maybe would have. So we really need to encourage people and to pray that people would seek help earlier, because there are ways that this can be done safely through primary care, through the doctor's surgeries, so that people can get help for things that they are maybe too scared to, because they don't want to either put on the doctor's surgery because they see we're all very busy, but also they're worried about getting the virus.
My prayer request at the moment would be for all those people who are stuck at home on their own, especially the elderly, who normally would have been enjoying their independence but are now reliant on other people to do things for them. I pray that we would not forget them in our prayers.
What can you be praying for us as midwives or for the midwifery team? Firstly, that everybody remains safe and well. These are really exceptional times. You can also pray that our expectant mums feel safe and relaxed in our care, because it must be exceptionally odd and unnerving for some of them to actually see us like this all the time. And just pray that their babies remain safe and well as well.
Prayer that would be important in this particular job role would be for our more vulnerable adults, particularly the older generation. Isolation is such a big deal already and always has been in our communities, unfortunately, but this really has sort of brought it to attention of others, and it's been great to see such an increase in support from volunteers, from neighbours, whether it's supporting with a meal or with shopping. It's been great, and I just pray for that to continue even past the isolation period and sort of the peak of this virus. I pray that it continues, so sort of isolation has become a lot more acknowledged, a lot more supported, and hopefully really reduced.
I think this is one thing I think we really need to pray around, is everyone's fear. And although I understand that fear, it is very real, and it's really having such a detrimental effect on staff as well as patients, because everybody is so fearful about getting the virus. So I think maybe that fear, that real threat of this virus that people feel, that's something that we can pray for. The word that keeps coming back to me time and time again is for protection. I feel, particularly with our patients we've spoken to who have to shield, they have to stay indoors for 3 months, and obviously other patients that are vulnerable, and everybody else, you just feel that we need God's protection over all of us, over everyone, but particularly over the most vulnerable people.
And we'd like to say a huge thank you from everyone at Andover Baptist Church to all of our carers all across the world for the amazing work that you are doing. Thank you.